I remember in the 5th grade when I told my classmates that I was going to be an artist. But they used to ask me, and the teachers too, well, why you want to be an artist? I said, I learned early on that when I'm making art is when I'm the happiest. I'm a retired art educator who's back in the studio producing art and working in the community with arts activities. From 67 to 70, I was at the Living Arts Center as the arts director, guiding this very exciting program on arts and education for young people. My primary care doctor had me working with preliminary specialists, and we've been watching a spot on my lungs for years.
So basically we were monitoring his imaging, the CAT scans, to see if there was any change in the size of these nodules. And we're also monitoring to see if you'd have any more symptoms, such as worsening cough, or if it's having weight loss or other systemic symptoms.
So we did a biopsy directed towards some specialists and found out that it was cancerous, and I needed to give some serious thought as to what I wanted to do.
In addition to finding the cancer, the next step we do is what we call staging the disease. So we do further imaging to see if the cancer is anywhere else in the body. So we do tests such as PET scans to determine if the cancer is outside the chest. And luckily for Mr. Davis, it was all contained within the chest.
The first thing that goes through your head, you start to think about all the things that you have planned to do, and all the people you want to see, and all the people you need to say hello and that you love.
On Mr. Davis's case, it turned out to be that surgery would have been the best option for him. So I then consult a cardiothoracic surgeon, and typically we use Dr. Rodriguez from Miami Valley Hospital.
Well, robotic surgery is a minimal invasive procedure for, in this case, for lung cancer. So the surgeon will do 5 small incisions in the chest cavity, like less than 1 centimeter. And we'll put these long instruments, were very small, inside the chest. And then the surgeon will look in a console we have is a 3-dimensional and also 10 times magnification. We call it robot, but the machine doesn't have any artificial intelligence. The machine actually will do exactly my hand's movement. So it's not a robot that is doing things on their own. Actually, everything is done by me, and then extrapolating in the robot inside the patient. So you can do all the dissections around the vessels and around the airways, around the cancer, without being inside the chest with your hands. It's just very small instruments.
And that was a wonderful, pleasant surprise too. Is that because until I needed it, I never thought much about it. But to be able to have a great need for these skills and expertise, and to know that they were so close by, was a comforting area as well. And gave me another level of appreciation too for my hometown, which I have loved so deeply and tried to give so much. So it's been a wonderful experience, and to think of the quality that I was able to get right here at the Miami Valley Hospital in a critical area of need at a critical time is comforting. That I didn't have to go to Cleveland, didn't have to go to Chicago or New York or Cincinnati, but I could receive these services right here in the Dayton, Miami Valley area.
We have excellent surgeons in town who do robotic surgeries, and we do state-of-the-art treatments here, either radiation or chemotherapy or immunotherapy. We do have clinical trial access through DCOP, Dayton Community Oncology Program, and then if we need some help, we do have MD Anderson affiliation. So with all these, we seldom have to refer patients elsewhere.
When I saw Mr. Davis in the postoperative office visit, then we talk about the pathology. His pathology show what we call N1 disease, which is a lymph node that was positive. Therefore, adjuvant treatment is recommended. Then I refer him to Dr. Catula for adjuvant treatment, which can be chemotherapy or immunotherapy.
Stage 2B has a very high chance of recurrence, like 50-60%. And then that's when he came to see me for further treatment to reduce the chance of recurrence. And then we were looking at chemotherapy versus immunotherapy, because immunotherapy is not approved yet for this type of situation. So that's why they are doing a clinical trial through Dayton Community Oncology Program. And he was very much interested in that because immunotherapy has much less chance of side effects when compared to chemo. Chemo has many side effects, including nausea, vomiting, mouth sores, hair loss, low blood counts, infections. Immunotherapy is much better tolerated. So he was praying and hoping that he would be eligible for immunotherapy, and finally he was, and that's what he has been getting. The goals are to reduce the chance of cancer coming back. So the goals are the same, but the chemotherapy is short, it's 4 cycles, as opposed to immunotherapy, which is like a year of treatment, but it is much better tolerated even if it is a year of treatment. So far he has done very well.
And I've always been a team player, so I'm really appreciative of the team that's got me to this point. I didn't know some of the players when they came on board, but boy, talking about a dream team. I had a dream team. I had and that's what I remember most. My wife and I talked about it. I could hear in their discussion their commitment to their craft and their commitment to getting me as healthy as they could. They didn't know me from Adam, and they gave me their best.
For Bing Davis, there is hope, yes. For his stage of cancer, for whatever treatment he's getting, so it is working good in metastatic setting, the immunotherapy, and now he's getting it in adjuvant setting, what we call after the resection of the tumor. So there is a good chance that he can be cured with this disease.
Art is something you can do as long as you have physical energy and breath. So I see myself just continuing to make art, smaller scale, not as often. I'd love to say 20 years from now, 50 years from now, certainly 10 years from now, to still be able to just enjoy the making of art, which is a reflection of life. If someone can add to your spirit, and you can pass that good spirit on to the next person, that's an even longer legacy. Long after even the name is no longer remembered. So to me, the joy of making that legacy object is one thing, but the joy of having lived is even greater.